Good morning, everybody. It's great to be here at Bosley Park, and also pleasing to know that overnight New South Wales had 4 cases, one of which was in hotel quarantine and 3 which were locally acquired but to existing cases. But what I do want to stress, and which Dr. Chant will highlight in her report, is that one of the people who contracted the disease actually was wearing a mask. So health is investigating the likelihood that they actually got the disease from touching a surface or exchanging the same material. So it's really important to know that masks are important. You should be wearing them in the places we've asked you to wear them. But they are only one piece in the line against our defence. So please know that there are a number of things all of us have to do. If you have the mildest of symptoms, you need to get tested and stay home and isolated unless health tells you otherwise. You need to make sure you're maintaining hand hygiene, make sure you're maintaining social distancing, and of course wear a mask in those environments we've asked you to wear. Whilst the number of cases is low and declining in New South Wales, I think what cases like this remind us is just how contagious the disease is. And whilst yes, we can all look forward to a summer that's less stressful than perhaps the last few months have been, we always need to be on our guard, because this disease is like none other that we've experienced. It's extremely contagious, and even if you're wearing a mask, you can still get it and you can still unintentionally give it to others. So it's important for us to stick to all the rules, all the health advice we've been given, not just one part of it. And I really want to stress that message. But today it's great to be out and about in Bosley Park, a fantastic school here in Western Sydney, where we are showcasing the best in class teachers. We have hundreds of teachers, in fact 700 of them across the state, who are part of this program. And today I've got Eddie, Mel and Livia, 3 teachers who are leading in their fields. And what these teachers do is provide peer support to other teachers in their professional development. And of course, in the last little while, there's been a particular emphasis for Year 12 students to help them cope through the HSC. So anything we can do to reduce the stress of our HSC students, we will. And today's 3 teachers are phenomenal examples of peer support and peer professionalism and development to make sure that teachers are given the best tools from amongst them in wonderful professional exchanges, in particular to support Year 12 students going through a difficult time. But today, Dr. Chan and I also have the very positive advice that on Friday there'll be guidelines issued to confirm, and I want to say confirm in the strongest possible way, that there will be formals and graduation ceremonies allowed in Term 4. And because they are one-off events, health will give specific advice, which is obviously less strict than advice normally for events of that nature. So Dr. Chant will on Friday confirm the advice provided to all schools for Year 12 and in Term 4. Until this point in time, there has been some initial advice provided to school communities, and we're waiting their feedback, and health will be able to confirm what the extent to which schools can hold those events in Term 4. But I want to confirm every school community across the state will be able to have a formal, will be able to have a Year 12 graduation ceremony. It may not be the same exactly as what happens in previous years, but I want Year 12 students and their families and their teachers and school communities to know that you will be able to have those key milestone events, and you will have something to look forward to after the HSC. And in the meantime, all of us want to be here to support you in your studies, to support you in Year 12, and know that at the end of your long process, at the end of your years of learning, and what's been a very difficult time for everybody, you'll be able to enjoy those key milestone events. I now ask Dr. Chant to give her update, and I also wanted to acknowledge the efforts of Minister Mitchell, our Education Minister. She and her team have done an outstanding job supporting all school communities during COVID. It's been a very difficult time. But I want to thank, through Minister Mitchell, her department, the outstanding teachers, some of whom we have here today, and also the students who've had to be really flexible and resilient and really dig deep to be able to cope during these times. And I also want to acknowledge the principal of Bosley Park and thank her for hosting us today, and say how incredibly proud she should be of this wonderful school. Great example of public education here in Western Sydney. Dr. Chan?
There were 4 new cases of COVID were diagnosed in the 24 hours to 8 p.m. last night, bringing the total number of cases to 3,929. I am also going to speak about an additional case that came in after the close-off of figures, because it does relate to an outbreak that we're currently looking into. So in terms of those, one case was a returned traveller in hotel quarantine. And so now I'm going to talk about 4 cases and take you back to advice we issued on, I think it was Saturday, in relation to an emergency department healthcare worker who worked 2 shifts whilst infectious, one at Concord Hospital on the 1st from 2 p.m. to 12 midnight, and then a shift at Liverpool Emergency Department from 8 a.m. to 6:30 p.m. We released those details and undertook extensive contact tracing. So the contact tracing involved identifying any patients that the healthcare worker had interactions with, as well as staff within the emergency department and the broader hospital, as well as their close personal contacts. The extensive testing has been undertaken over the last couple of days, and what we've identified is that there are 3 healthcare workers and 1 visitor who accompanied a patient to the hospital associated with those times that the emergency department doctor was working or when he presented for care. So I just want to take you through some of our thinking. So as the Premier had indicated, we're obviously very keen to look at how transmission occurred in these settings. I can assure you that the staff, the ED healthcare worker, was wearing masks and had full personal protective equipment when patient encounters, and was wearing a surgical mask at all other times. I think this just highlights the fact that we are exploring avenues of whether there could be fomite transmission. So what that means in lay terms is if your hands are contaminated and then you're touching computer screens or touching pens and pencils, pieces of paper, can you actually transmit the virus? And the way that the mechanism that could occur is if someone has contaminated their hands, touched those items, and then inadvertently the person who has again got their hands contaminated touches their eyes or mouths or adjusts their masks or plays with their face. And whilst that may sound something like we don't do, I was just pausing myself over there because it's actually very hard to never touch your face. And sometimes when you've got masks on, you also adjust it when they feel uncomfortable or just readjust them. So I think we need to continue to investigate how this transmission occurred, but that's just some of the thinking that we're investigating, because at the moment, for some of the cases, there isn't that clear-cut direct contact without a surgical mask. So at the moment, we are seeing low numbers of cases. But as I said, because these are occurring in a healthcare worker setting, we're very keen to explore exactly how the transmission occurred, and that's essential so that we can prevent wherever possible these transmission cases occurring. People should be assured that hospitals are safe to go to, that there are strong precautions in place. But as usual, we just remind people that there are a number of options for people to visit their GPs and call Health Direct online if they need health advice. And please feel safe in attending emergency departments. Thank you.